What is Octaplasma? Octaplasma is a pathogen inactivated, standardized human plasma licensed as a biopharmaceutical product by Health Canada, indicated for complex deficiencies of coagulation factors, emergency substitution therapy, and rapid reversal deficiencies of effects of oral anticoagulants when vitamin K is insufficient. Octaplasma is manufactured using multiple dedicated viral inactivation and removal methods to reduce enveloped and non-enveloped viruses and prions. Octaplasma is cell and debris-free to ensure the removal of intercellular pathogens and abolish cell-dependent adverse reactions. The use of Octaplasma has demonstrated reduced allergic reactions, immune-mediated transfusion reactions, and no cases of reported transfusion-related acute lung injury, or TRALI. Pathogens are dynamic, global, and they continue to emerge. The ongoing emergence of pathogens highlights the importance of ongoing surveillance and response efforts to minimize the impact of these diseases. Current reactive screening for pathogens is impractical and does not account for emerging viruses or viruses not screened for. A proactive approach is needed to stay one step ahead. Safety from blood-borne pathogens is critical to the blood system. Octaplasma is the new standard of care, fulfilling the important safety requirement for blood products and safeguarding the blood system. Multiple clinical studies and retrospective analyses have been conducted to examine the safety, tolerability, and efficacy of Octaplasma across several indications. Octaplasma is now available to all patients where the use of plasma is indicated, and all hospitals served by Canadian Blood Services can now order Octaplasma. While using Octaplasma in your institution, here are some practical considerations. Storage. Octaplasma is supplied frozen in bags of 200 milliliters. The shelf life of Octaplasma is 48 months when stored at less than -18 degrees Celsius. After thawing, Octaplasma can be stored for up to 5 days at 2 to 8 degrees Celsius, or for up to 8 hours at room temperature, 20 to 25 degrees Celsius, before use. Thawed product must not be refrozen. Unused product must be discarded. For dosage and use, see package insert. Follow instructions for use carefully. Thawing using a water bath. Thaw in the outer wrapper for about 30 minutes in a circulating water bath at 37 degrees Celsius. Allow the content of the bag to warm to approximately 37 degrees Celsius. The temperature of both the water bath and Octaplasma must not exceed 37 degrees Celsius. Octaplasma must be fully thawed before infusion. The thawing time depends on the number of bags in the water bath. If multiple plasma bags are thawed at the same time, in the same water bath, the thawing time may be prolonged. The overall thawing time should not exceed 60 minutes. Administration. Ensure Octaplasma bags are fully thawed before infusion. Incompletely thawed bags may show residues and must be thawed further. Avoid shaking. Do not use solutions that are cloudy or have deposits after the bag has been fully thawed. Visual assessment guide for Octaplasma bags post-thawing. Proper thawing of plasma produces a clear, yellow solution indicating it is suitable for transfusion. On rare occasions, bags may contain clots, fibrin strands, or denatured proteins. This is often seen when plasma bags are improperly thawed. In these cases, particulate matter may appear as white, opaque masses that do not dissipate with gentle manipulation. Plasma bags with white, cloudy deposits should not be transfused. Healthcare professionals should use their clinical judgment and follow appropriate thawing instructions in the Octaplasma product monograph. Administration of Octaplasma must be based on ABO blood group specificity. In emergency cases, Octaplasma blood group AB can be regarded as universal plasma since it can be given to all patients. Octaplasma must be administered by IV infusion, using an infusion set with a filter. The infusion rate of Octaplasma should not exceed 1 milliliter Octaplasma per kilogram body weight per minute. Please check with your hospital protocols as it may differ from the recommended infusion rate. Since 1992, more than 11.8 million bags of Octaplasma have been infused into 3.9 million patients. In Canada, Octaplasma has over 7 years of clinical experience with more than 91,000 bags infused. Learn more about Octaplasma and its uses by visiting www.octaplasma.ca.